So now we're going to talk about the blood vessels, kind of beginning part of it. So first is blood vessels you can think of as the pipes or the tubes of the cardiovascular system. So they are in a circuits, depending whether it's pulmonary circuit or systemic. But either way, it begins, so it starts and ends at the heart. So we'll kind of talk about that, kind of each part of the circuit coming up. So arteries are going to be again A for away. So arteries carry blood away from the heart, and they're considered efferent or exiting vessels because they're going out of the heart and away from it. So most of the time, except for the ones that we're talking about in the heart, oxygenated blood. It's blood from the lungs that has picked up oxygen and going to the rest of the body. It is deoxygenated blood with pulmonary circulation. So remember, the pulmonary arteries is deoxygenated blood. So this is going to be different. Everywhere else, except for that and umbilical vessels of the fetus, so going from mom to fetus, mother to fetus, through those umbilical cord, that is going to be deoxygenated as well. Other than that, it's going to be oxygenated. It's already gone to the lungs, picked up oxygen and gone. So that's kind of typical when we think of them on the models, especially as red. Veins are going to go towards the heart or bring blood back to the heart. So they are the afferent, always going towards. Again, same thing. Most often is deoxygenated blood. Blood is gone through the capillaries, discharged its oxygen, and is going back to the heart to recirculate to the lungs again. Again, separate pulmonary circulation. The pulmonary veins are going to carry oxygenated blood because they're going towards the heart from the lungs. And so then they show different. Same with umbilical vessels. The veins are going to be oxygenated as well when we're looking at the umbilical cord between female and fetus. So most often on our models are going to show as blue, showing that it's deoxygenated blood. So between arteries and veins, so we go arteries, they're carrying blood away from the heart. Most often it's oxygenated. It then goes into the capillaries. The capillaries are going to be the smallest vessels in your body, and they connect both the arteries and the veins to make the end of the circuit. So you come down with an artery, you go into the capillary bed, which we'll talk about later, and then you go away with a vein. So it has that connection. One side is going to be the arterial side, one side's going to be the venous side, because this is where exchange is going to happen. It has direct contact with tissues. So this is where oxygen is going to leave and carbon dioxide is going to come back in, nutrients is going to leave, waste products are going to come back in, and then recirculate. Typical artery is usually round in shape, so they kind of hold their circular shape like a pipe, and usually they have a thicker wall. So we'll look at the wall next. Again, blood away from the heart, no matter whether it's oxygenated or deoxygenated, it's away from the heart. Veins have a thinner wall, and oftentimes they come flat. If there's not blood in them, they'll flatten out, and they're kind of a lot thinner in appearance. And again, blood toward the heart. And we do see that veins do have a little bit more smooth muscle in kind of all of the veins. That's because depending on what artery it is, it's not going to have a lot of smooth muscle. It'll have more elasticity to it. So all blood vessels, not all. So whether it is an artery or a vein, because capillaries are different, it's going to have 3 layers, and they're going to vary in kind of content and size based on whether it's an artery or a vein. but they have three tunicas, is what we call them, so tunics. Intima, so you can think of intimates as the internal layer, so the most internal layer. So first is going to be the intima, which is most inner layer. Media, think media middle. So that's the middle layer. And then externa, think external, that's the outermost layer. And again, this is going to be arteries and veins. All vessels, including capillaries, have a lumen, meaning they have a space in the middle. So with all these layers, this would be the lumen. So there's always a space in the middle, surrounded by the tunica intima, where blood is flowing. That's the purpose of them. They're the piping system, so they're for transport of blood around the body. Capillaries don't have these layers. They only have an endothelium. So most often this is going to be simple squamous endothelium layer, so a very thin layer, and has a little bit of basal lamina where these can stick to. Why do you think that's so? If capillaries are where exchange is happening, where oxygen is leaving, carbon dioxide is coming, well, you don't want a lot of space and a lot of layers to go through for this exchange to happen. So having a very thin layer, just simple squamous cells, you're able to go through and transport materials a lot easier and faster. It would take a lot longer and a lot more difficult if we had tons and tons of layers of cells that we had to go through. So that's why capillaries are different. If you had to go through this much, well, it takes a lot more effort versus going through that. So it's again, same thing of it's easier to cross the street than run a mile. And you're going to get there faster if you're just crossing the street versus a mile down the street. So looking at each layer of the tunicas, so tunica intima is the first one. It's also, you may hear it as tunica interna. Again, it's the innermost layer. So this kind of grayish on the picture is going to be the tunica intima. It does have the endothelium, which is that layer of simple squamous cells that's going to be right there. So it's that kind of internalmost layer is endothelium. In arteries, you're going to see a layer kind of elastic membrane. So this is showing you a picture of an artery. So you can see kind of this red line, squiggly line going down. That is going to have a layer of elastic fibers, so a layer of stretch. So think of arteries are going to be higher pressure. So they need more flexibility and stretch available to them so they can stretch when the pressure is up and then kind of retract. So that's the pulsation that you get from arteries. A lot of them is they have increased pressure and they have elasticity to them, and then they recoil. So that's a characteristic of arteries in the tunica intima that veins do not have. Middle layer is going to be your largest layer, at least in arteries. It's the middle layer. This is going to have sheets of smooth muscle. So you can see here all of the smooth muscle that you can see. At least in arteries, again, you're going to have where this occurs of vasoconstriction and vasodilation. All of this smooth muscle, if it contracts, then all of a sudden it's going to go from this lumen opening to all of a sudden this. This is a decrease in vessel diameter. There's a smaller hole for blood to go through here than here. And so this is called vasoconstriction. And like I said, most often we talk about arteries when this. If you went from this to this, where you're gone from, or even kind of in between that, and then you go to a larger diameter, then that is called vasodilation. meaning the vessel is relaxed, and it's dilating, meaning the hole is getting bigger. Then also in arteries, we have an external elastic membrane, so more elasticity that's between the tunica media here and the tunica externa, which is going to be here. So all this is smooth muscle, majority of it. You do have kind of fibers, elastic fibers in between. Again, arteries do have more elasticity to them. Tunica externa, also known as the tunica adventitia, is the outermost layer. That's going to be connective tissue. So in arteries, it's going to have collagen, fibers, and more elastic. In veins, it's actually a larger and thicker than the tunica media. So you actually have more tunica externa out here in a vein than you would have in media. It also has more elasticity in the tunica externa and also extra smooth muscle that's going to be in this area as well, in veins. Also, part of it is going to help hold the vessel in place. As blood is moving, it's not bouncing around, it anchors and holds it to where it should be. So looking at the types of arteries. So the largest arteries are what we call the elastic ones. If they're closest to the heart, they really need to stretch and recoil. So things like the aorta is going to be a major elastic artery. It's right next to the heart. All of a sudden, the left ventricle pumps and ejects a whole bunch of blood out into the aorta. Well, it needs to stretch out and compensate for all that blood flow, and then it'll recoil. Same with the pulmonary trunk coming off of the right ventricle and its associated branches. So the largest arteries coming off the heart, and as they're getting smaller, they change into muscular arteries, but this part is elastic. Muscular arteries are their middle size. So these are going to be ones that bring blood to the skeletal muscles and your internal organs. So these are going to be the kind of middle ones that are bringing a lot of blood to kind of important things like your skeletal muscle and your internal organs. So you can see elastic artery does have that internal elastic membrane, more elasticity in the layers in the muscular artery. And so you can see here, there's less smooth muscle here. In the muscular artery, there's a little more smooth muscle, and you're going to see less elasticity here. We're going to talk about arterioles next. Arterioles don't have a kind of, they do have a tunica externa, but it's hard to see. A lot of it's mixing with the tunica media. And the tunica media isn't that much kind of thick either. So we're getting to thinner walls because we're going towards our capillaries. So as we kind of get towards our capillaries, they get smaller and smaller. There's less kind of layers for it as we lead into the capillaries. So only a little bit of smooth muscle and then endothelium. So not as many defined layers that we see in the larger vessels. So again, capillaries, this is the only place that exchange can happen. So this is the only place where blood can deliver oxygen and pick up carbon dioxide and bring in nutrients. So the only time, the rest of it is just pipes. The rest of it is just distributing to the capillaries and bringing it down. So no matter what, everywhere else, aorta, just a pipe. Splenic vein or splenic artery, just a pipe. And once we get to capillaries, then we're getting to the actions actually happening. And we'll talk about how exchange happens later. Again, they just have some basal layer or basement membrane and endothelial cells, which are swivel squamous. So very thin to allow for diffusion to happen very easily. Now we're going to the other side of the capillaries. So again, arterioles are coming down and they're leading into capillary bed. And then we're going and leading out of the capillary bed is called venules. They're the smallest type of veins. They don't have a tunica media, and they look like a little larger of capillaries. So arterioles are getting smaller, only a couple layers of smooth muscle and lead into the capillaries. Veins aren't that much bigger as well, but they're not as much smooth muscle as it's going to be just connective tissue. So they're going to pick up blood from the capillaries. Then we're going from venules to medium-sized veins. They don't have much in the tunica media. So there is kind of the smaller layer here. You're never going to see a very large tunica media as compared to the arteries. And there's some smooth muscle there and some collagen fibers. The thickest layer with veins, unlike arteries, the thickest layer is the tunica media. This is the tunica externa. And we have more elasticity and we have collagen fibers here. Then we get to the largest veins. They're going to have all of our three layers. They have, again, still thin tunica media and a thicker tunica externa. So these larger veins are the ones that are going directly to the heart. So the superior and inferior vena cava is going to be the largest veins. So just looking at differences between veins and arteries, again, the media is going to be the largest layer in the arteries with smooth muscle. The veins have more smooth muscle kind of throughout all the layers, but the arteries just have it in one layer, and that allows it for vasoconstriction and dilation especially. Largest layer in veins is the tunica externa. So we're just kind of looking at kind of comparing a chart, comparing arteries and veins that you can look at. So just kind of what we see for kind of the difference in the different layers.